استغفر الله العظيم. What about the psychogenic, as I mentioned before? It is a sudden psychogenic stress, maybe following acute laryngitis, or there is sudden loss of voice. The voice is only whispered, but the other non-verbal laryngeal function is intact, like coughing or crying or minimal associated pathological lesion like vocal fold, polyp, nodules, and so on. Now I'll show you some pictures to different laryngeal pathology. This is what's called sulcus, as a congenital lesion, organic congenital lesion, in which the vocal fold is divided, the muscle of the vocal fold divided. So I have an upper lip and lower lip, and hence the voice affected. Another thought. This is trauma to the larynx with a submucosal hemorrhage, submucosal hematoma after a trauma to the larynx, either heterogenic, physical, or this is a cancer, a mass, another mass affecting the larynx. This was called laryngeal polyp. It's a fleshy, and this is polyp should be treated by microlapryngosurgery. Another polyp. Another polyp, but this is a telangiectatic polyp type of the laryngeal polyp with a reaction on the other side of the larynx. And this is such deeper pathology, and this is laryngeal cyst. This is nodules. Nodules can come in a female, in adult female, but not in a male. Usually nodules affecting the short larynx, like that of female and children. Never to come in a male. You see, thickening of the mucosa here. And this is, of course, Ronyx edema with a watery bag-like in the vocals. How I can diagnose a voice disorder in general? The 3 steps of diagnosis will become. First one, elementary diagnostic procedures, meaning I'm just listening to the patient in an interview, listening to his voice and assess the voice, if it is leaky, if it is breathy, hypo or hyper function voice. Then, after I'm here, I should see the larynx with the laryngeal examination, external or internal laryngeal examination by indirect laryngoscopy. Clinical diagnostic aid mean I should augment the laryngeal picture by examining the larynx by endoscopy. Actually, the movement of the vocal fold looks like the movement of the flyable cover over a hard body, which is a muscles. This is the mucosa over the muscle, like that. Sorry. This is a rigid endoscopy that introduced through the mouth of the patient. But in a gaggy patient, you can introduce such endoscopy and can use a fiber optic endoscopy that introduces through the nose and see the larynx very well on the monitor. Another sophisticated maneuver for a voice disorder to be assessed, like aerodynamic, acoustic, voice range profile, and so on. This is more sophisticated maneuver, just you have to know the names of them. How can I manage a voice disorders in general, the three category, organic, functional, and minimal associated pathological lesion? You can give pharmacotherapy in certain cases for evident infection or allergic etiology. And what is called behavioral readjustment voice therapy, and this is come well in cases of functional voice disorders. As I said before, functional voice disorders is come due to abuse and misuse of voice. So you have a faulty vocal behavior. That behavior should be readjusted or corrected. And hence behavior readjustment voice therapy. It can be used as a primary main line of treatment in cases of functional voice disorders and can be used as a complementary treatment modalities for phonosurgery, following phonosurgery, or pharmacotherapy. Behavioral readjustment meaning that if something wrong, I should stop. Something my behavior wrong should be stopped, and I have to start a correct behavior. So, behavior readjustment, meaning a voice hygienic advice, have two categories, do and do not category, and try to do category. Do and do not category, you have to avoid smoking, screaming, spurts. Try to drink more fluids, avoid clearing the throat like that, and avoid dry, dusty places. What is the indication of voice therapy? As I said, all cases of functional voice disorders, either habitual or psychogenic, phonothenic case of phonetina, hyperfunction disorder, mutational voice disorder, comes well with the organic, it comes well with the voice therapy. Listen, this is a case of ventricular dysphonia.